All right, welcome everyone. Thank you for coming this afternoon, especially given the circumstances. I know some of you probably had to swim across parts of campus to get here. But I think you'll find that it was worth the trip. I'm very excited to introduce our guest for today on behalf of the Schroeder Center. Gabriela León-Pérez is an assistant professor of sociology at Virginia Commonwealth University. Her scholarship and research is at the intersection of migration and health, and her work has advanced our understanding of internal migration in Mexico, the experiences of immigrants in the United States, health inequalities for indigenous populations, among other contributions. So she joins us today to talk about some of her more recent research, a project engaging with the Latino community in Richmond to understand Latino youth mental health. Please join me in welcoming her to William & Mary.
All right. Thank you so much for the introduction and for the invitation. And thanks everyone for being here on a Friday, first of all, and then also on a rainy Friday. So special thanks to all of you for being here. And I'm really excited to talk about the project that I'm going to talk about today because it's the first time that I present it to anyone. So you have like first dibs on like hearing about what we've been doing in Richmond. And so I'll speak for about maybe 45 minutes, and then I would love to have some time for Q&A or just hearing from you any questions that you might have about this or about other projects that I have. So, but before I start, I thought I would talk a little bit about my academic trajectory, kind of like to show you where I'm coming from and kind of what has inspired some of the research that I've done. So I was born and raised in Mexico. On the Mexican side of the Texas border. So I was always kind of like familiar with like comings and goings of people. And I went to college in Mexico, in Monterrey. It's a city in northern Mexico, industrial city. I see some nodding. And I did my undergrad in international studies. And I thought that I was going to work for like the United Nations or like work in an embassy somewhere around the world. But then I graduated from college, and by that time my parents had moved to the U.S. side of the border, so they had immigrated to the U.S. I went back home and I got a job in international trade and import-export, which is kind of like what you do at the border. We've been hearing about tariffs a lot, so that is kind of like what the line of work that I was doing, but it just wasn't for me. So I started studying part-time a master's in sociology while I was working full-time. And I didn't know what sociology was, and I've heard some students, for the most part, we don't know what sociology is, but I just looked through the university's list of master's degrees. Sociology seemed to offer some interesting classes, so that's what I enrolled in. And I see, again, some nodding. And yeah, so I was studying at night, working during the day, and I just really loved what I was studying, and I had the opportunity to get involved in a research project with a professor, and I knew that was kind of like what I wanted to do. So I left my full-time job to finish my master's, and then I went to Vanderbilt in Nashville to study a Ph.D. in sociology. And my Ph.D. was funded by the Robert Wood Johnson Foundation through a health policy fellowship. So I was also able to take health policy classes at the Robert Wood Johnson Center that was housed in, or maybe still is, in Meharry Medical Center. So then I had like a little bit more training on that part of like the health policy part and advocacy. And then I came to VCU as an assistant professor. I've been there for 7 years. And just to show you a little bit of what I do, my research and the classes that I teach kind of like fit at the intersection of the sociology of migration, medical sociology, so I study a lot of my research is on immigrant health, but more and more I've been looking or doing research that fits more squarely in Latino studies or the sociology of Latinos. And this, I was trained as a social demographer, which means that like a lot of my research in grad school was population-based, and my dissertation was like heavily quantitative, looking at like longitudinal data, doing survey research. And I still do a little bit of that, but I've more and more kind of like been getting into qualitative research, including the project that I'll present today, but also community engaged research, and working more closely with the community to understand their needs and to develop research jointly. And just to kind of like share a story, when I was in grad school, I worked as a graduate assistant as a research assistant on a project that was being led by a genetic anthropologist. Amy Nunn is now, she's at UC San Diego, but she was at Vanderbilt. And we were doing first focus groups with Mexican immigrant moms, and then with those findings, we developed a survey that was, we were doing it at people's houses and in-person survey. And I already kind of like knew all my spiel, and you present, for those of you who have been involved in research studies, when you're starting an interview or a survey, you have to give kind of like you go through the consent process and explain kind of like what you're gonna do, and then part of that consent process is explaining like, well, you won't gain anything from this study, right? But you will kind of like, you will contribute to the well-being of people. And there was this one woman who was like, okay, so how? And she wasn't being mean, like she was genuinely curious, like, so how is it going to contribute to people's well-being? I'm like, well, I mean, it could inform policy. She's like, yes, I mean, yeah, but how? Well, like people might find the journal article that we published. So I just felt just really stumped, and it made me realize like, yes, like we want our research to kind of have an impact in like society, but then like how is that really changing people's lives? So that has really stuck with me, and that has been one motivation of me kind of like doing research that on the one hand does like advance science and scholarship, but on the other hand that can have more practical implications for people's lives. And one area that I've been particularly interested in since coming to Virginia is the experiences of Latinos in Virginia. And I mean, like in other parts of the South in the US, the Latino population in Virginia has exploded right now. This chart is from 2020. It says that Latinos, Hispanic, which is the red in this chart, says 10.5. Right now, I think it's at about 11.2%. But actually, and I think many of you must be from Virginia, that this is kind of like the makeup of the population in Virginia as a whole. But there's actually a lot of variation in the sizes of the Latino communities across the state. So just kind of like take a look at this. This is the percent Hispanic or Latino in all the different counties in Virginia. And I mean, the font size is really small, but the very first one, almost 45% of Manassas Park City is Hispanic or Latino. The next is Manassas, and then we have Prince William County, Winchester City, and then kind of like goes down across the state. But I'm just imagined like how different people's lives are depending on where they live, right? Even in this just one state. Williamsburg, I looked it up, it's about, it's around here, it's 8% of Williamsburg's population is Latino. And actually, and just to give a plug for one of my other studies, we kind of, because Virginia has a very particular history, and we're still grappling with the history of slavery and the Civil War. Society and the political sphere in Virginia is still very much centered on white and black relations. It has been so historically, and it continues to be so, even though we have other groups that have been steadily growing, including Latinos. So one thing that I've been really interested in is kind of like, how do Latinos fit and find their way in Virginia, like once they have called it a home, right? Like especially, like what is it like being Latino, let's say in Manassas Park City, where 45% of the population is Latino, versus Russell County, Virginia, which is the very, very last one, that I think it was like 0.3%. So really the context really matters, right? So one of my projects in collaboration with Dr. Daniel Morales in the history department at VCU is Latino Virginia, which is an oral history project where we're collecting the life histories of Latinos who live in Virginia, both immigrant and US-born Latinos. And as long as people have been living in Virginia for at least a year, we're interviewing them. We have a lot of students involved in the project. They're doing many of the interviews. They're in Spanish or in English because, again, about half of Latinos in Virginia are US born. And we are going to, we're doing research on one part. Of course, we want to publish articles, maybe a book about these stories. But another kind of like important element that connects back to what I was saying of community engaged research and research that can like have an impact on the community is that we're creating a public digital archive with many of the stories that we have collected. So far, we've done about 100 interviews, and these are interviews that include history of migration, how people chose Virginia, why people chose Virginia, relations with people abroad, family here, inter and intra-ethnic relations, what else? Identity, experiences in the school system. But before each interview, we ask people if they would be willing to have their interviews be part of this digital archive. It's going to be a website, and it's being built this semester, and so that anyone can like have access to these interviews. And about 2/3 of the people that we have interviewed have agreed to have their stories shared publicly. Some of them with their real names, others with pseudonyms, so those we will like redact to take out some like identifying information, and a few others have asked for our interviews to just be kept private. So this is kind of like Latino Virginia and this creating more awareness of the Latino experience, because Latinos have been in Virginia since about the 60s, like in important numbers, especially Virginia Beach because of the military, a lot of Puerto Ricans, but we had a lot of migration from Cubans in the 60s following the revolution, and then it has continued to grow. So the project that I will talk about today focuses specifically on the Latino immigrant community in Richmond. So this is a racial dot map. Every dot represents 300 people, and the red dots are Hispanics or Latinos. And we can see at the top we have Northern Virginia, which is where we have this very big concentration of Latinos. Some of you might be from that area, and you know that there's like very big communities of Salvadorans, Hondurans, Central Americans in general, right? But also Richmond has I'm going to circle here. Richmond also has a very sizable population of Latinos, but that has actually been growing really, really fast over the past 20 years. So this chart shows the growth of the Latino population in Richmond with using census data. And even though I'm going to talk about Richmond, what I'm meaning really the greater Richmond area, which includes Richmond City, which is the capital of the state. Chesterfield County is on the south side. Richmond is really like divided by the river, so like south of the river is Chesterfield. Hanover County is on the northern part, and Henrico just kind of like surrounds Richmond on the top. But as you can see, 40 years ago, Latinos were just a very small part of Richmond's population. But then starting in the 90s, we start to see kind of like an upward trend. But it's really in 2000 when we see kind of like a very big spike in the growth of the Latino population. And it's actually about a 350% growth in this 40-year period, which is really fast, especially again for a city that had never seen any other groups of people, right? And in some of the interviews that I've done, people who got here in these early times, they said that like people couldn't tell, like, are you white, are you black, like what, how do I relate to you? So I think that's really interesting, just in terms of thinking about Latinos in Virginia in general, but also when we think about mental health and how the social context can have an impact on people's well-being. So since arriving in Richmond, I've been meeting with some of like the members of the Latino community, a lot of people who have been really involved over the past 20, 30 years in organizations serving this growing population. Most of them are Latinos themselves, and they're like really, really invested in this community. And as I've gotten to know many of these organizations and leaders in these organizations, we've talked about like wanting to collaborate on something. And collaborating about something that where the needs that they see in the community can be addressed, rather than someone like from the outside just saying, oh, I'm going to do this research in your community. And one topic that was coming over and over again in my conversations was the needs of Latino newcomer youth. So immigrant youth. And there's some students here in the room who have been doing some of this work here in Williamsburg. And I think it's just like the mental health of youth in general is really important and now has received a lot of attention. But the particular needs of Latino immigrants, it's different because they're shaped by experiences that happened in their country of origin, that happened in transit to the US, and that happened once they have been settling here. So even though, as we saw, there was like this big growth in the broader Richmond population, 350% growth. The growth of the Latino youth population of kids is even more impressive. So in the 2004-2005 school year, there were about 650 kids enrolled in all of Richmond public schools. Today, this school year, it's 5,865. That is an 800% increase in the size of the Latino population in the schools. And of course, schools haven't been ready to address the needs of this very new group of students who have very particular needs, not just in terms of language, but just in terms of the social emotional needs. And the Latino youth that we see that we have in Richmond, they pretty much experience similar mental health situations or problems as the broader Latino population. So as a whole, the most debilitating health issue within the Latino community are mood disorders, especially depression, but mood disorders can also include, for example, anxiety. Around 18% of Latinos suffer from depression during their lifetimes. But more importantly, the rates of major depression have increased across all age groups, not just adults, but also kids as young as elementary school. And something that is especially important for the project that I'm going to talk about is that Latino youth experience the highest levels of depressive symptoms relative to any other racial ethnic groups in the United States. And they also have the highest rates of suicidal ideations. And these symptoms may start as early as elementary school and then kind of consistently increase into adulthood. And actually, suicide is the third leading cause of death among Latinos ages 10 to 24. So we see kind of like these very internalized problems that really haven't been addressed and that, or in some cases have been addressed kind of like at the individual level or piecemeal level, but where we haven't really seen like great changes as a whole. Another example is that, for example, according to the Substance Abuse and Mental Health Services Administration, Latinos are significantly more likely than white individuals to report feelings of sadness, hopelessness, or worthlessness. And importantly, these rates are significantly higher among youth, so individuals younger than 18. And a study done by researchers at UNC found that 30%, so 34% of Latino youth experience feelings of sadness and hopelessness. So bringing this back to the case of Richmond, really the rapid growth of the Latino youth population has resulted in very deep mental health inequities because service organizations and schools, service providers have not been really well prepared to provide not only bilingual care, but this is kind of like what a lot of attention is based on, like we need bilingual services, we need bilingual counselors, etc. But that is not enough. That is not all that it is needed. We also need culturally responsive services that really reflect an understanding of immigration, of trauma, and acculturation. Like, it's not enough to just be bilingual. You really need to understand kind of like where these kids are coming from, socially, sociopolitically, et cetera, right? So this is kind of like where our project has been pointing towards. So another way to think about this is that the mental health problems that I described that are very prevalent among Latino youth, these are the problems that we can see, as we can see with this graphic, right, in the tree. These health outcomes, depression, anxiety, behavior problems like aggression that we see a lot, maybe destructive behavior, externalizing behaviors. Again, this is just what we can see. But really many of the services or programs that have been created, not just in Richmond, but as a whole, really focus on just addressing these problems, right, that we see, again, counseling, mental health services, et cetera. But these are mostly individual level approaches that while they might have an impact on like individual students or individual kids, they don't result in greater structural change, right? Because it's just a Band-Aid. It's not addressing kind of like the root cause of these mental health problems, right? So the project that I'm gonna talk about really the goal is to examine what are the root causes of mental health problems among Latino immigrant youth in Richmond, and what are some ways that we can make sustainable changes? So how can we address what is at the core or what is causing these very high rates of depression, very high rates of feeling not worthy or feeling helpless? So this is our big question. What are the root causes? And by that we mean systems, we mean structures of inequality, policies that can help us understand this context in which mental health inequities occur. So what we did is that I got together a group of organizations, and I'll explain a little bit more. And we decided to address this question by establishing a community academic partnership to focus on the mental health inequities among Latino youth. And together we came up with this name, Alliance for Latino Youth Mental Health and Advocacy. It's ALMA is the acronym. And we have our logo and everything. And I think the logo is really important because it's inspired in an idea, a thought, a goal that one of my community partners was, which is that I asked at the end of our first meeting, If Alma was a seed, what fruits would you want to see come out of this seed, right? And this one person said that she imagined Alma to either be a pomegranate or maracuya is in Spanish, passion fruit. And these are both fruits that have many, many tiny seeds. And she said, well, I want Alma to be like these fruits, where these seeds would then produce more fruits. So based on that, the logo is a passion flower, which then kind of like produces the passion fruit. So successful efforts to address social determinants of health demonstrate that multi-sector partnerships and collaboration are crucial to achieve health equity. So these are our partners in this project. Well, we have VCU. Specifically, I'm a member of the Clark Hale Institute for Positive Youth Development. They've really supported this project. But then we also have other organizations that span very different sectors and which engage with the Latino community in like very different ways. So we have Richmond Public Schools, which of course is like a key player and very important to have as part of this partnership. The Office of Immigrant and Refugee Engagement is an office that's part of the city of Richmond, and they support the immigrant community as a whole. But since Latinos make up the largest immigrant community, they have a lot of services focused on immigrant families. Then the Richmond and Henrico Health District, they are very important because, I mean, as a whole, just the public health department, but also very importantly, they have a health clinic, a community resource center that is right in one of the most predominantly Latino neighborhoods in Richmond. I have a picture in a little bit. It's a neighborhood called the Southwood Apartments, and actually one of the apartments was turned into a clinic. So they're like right there in the community and very much in conversation with them in terms of what their needs are, what they're looking for, et cetera. And then finally we have Waymakers Foundation. That's a nonprofit organization. They have a food pantry that provides culturally appropriate foods for the Latino community, but they also have a lot of other services and programs to support the community. They have like an art night for kids with their dads. They've had youth night to like bring the kids in to play different games. So again, they're also very much involved in the community. So our project, Alma, was supported or is supported by a Partnership Collaborative Establishment Award from the Jeffers Trust Awards Program in Research Advancing Health Equity. And this is a funding agency that specifically focuses on the root causes and systemic barriers to health equities in Virginia. So it's kind of very focused on Virginia outcomes and reducing health disparities in Virginia. And while this project that we're doing is a research project, we are doing research as part of this grant. The grant is actually not a research grant. The grant is specifically focused on creating sustainable partnerships, sustainable community academic partnerships, because one of the ideas is you can't have sustainable change if the project is just based like on a research study. There needs to be trust and mutual understanding between the partners so that you can actually achieve change in society, in the community. So these are the three goals that we currently have for Alma, and I'll go through them and then explain them in other slides. So the very, very first goal that we have with Alma is to establish a sustainable partnership where we incorporate every single partner's organization's perspectives, but also the perspectives of the community. And this has been crucial because we want to create programs or do research that really responds to the needs of the community. Instead of me as a researcher in my little office coming in and saying, oh, you guys need this, they're the ones who kind of like have a bigger say in terms of the direction that our partnership is taking. And that is also really important in terms of establishing trust, because I was saying in a meeting with students before, sometimes there can be a little bit of reluctance of working with universities, because they might see as them just like coming into the community, collecting their data, writing their paper, and then leaving. And they've seen it happen over and over again, and I think right now they're kind of like more guarded in terms of who am I collaborating with, and what are we getting in exchange? What is the community getting in exchange? And this is something that one of my community partners said directly, like, we've already seen this over and over again. People have already done focus groups. People have already done interviews. Like, then what? Like, what is going to be the outcome? And this is something that we as a partnership, as a group, are deciding together. But not only do we have these partner organizations, and for each of the partner organizations, we have staff, key staff from each of them. But also we created Latino and Parent Youth Advisory Councils. So we also want to hear or give enough weight to the voices and perspectives of the actual community who are kind of like dealing with these mental health problems. So these are kind of like the key players in our partnership. And together, we are doing joint strategic planning to conduct a participatory community assessment, not only to understand youth's needs, but also the systemic and migration-related factors that impact their mental health. So yeah, we already know that there's depression, we already know that there's anxiety, but we still don't have a really good understanding of the structural factors underlying those problems. And what this assessment will look like will be focus groups in the community with parents, with youth, and by youth we're looking at middle school and high school students, and then also with service providers or people who engage with this community. So teachers, counselors, social workers, any other individuals who kind of like engage in different ways with this community. And then our last goal is to create a directory of mental health services and resources, because there's a lot of organizations, a lot of people doing really, really good work, but sometimes people don't know about it. Like, it's all kind of like all over the place and fragmented. So we're trying to maybe create like a one-stop repository of like, where can people get these services, not only related to mental health, but related to like other social determinants of health. So that will be in year 2 of our project. So this is a picture of the steering committee. Not all of them are in this picture, but we have representatives of our 4 organizations. We started this project, we got the grant in the summer. We started, our first meeting was in September of last year, and we meet on a monthly basis. We meet at the offices of Waymakers Foundation, and it's all about, again, kind of creating this community, getting to know each other, and the needs that we see or that they see working in the community. Many of them already know each other because they've all been doing this work, right? But this has been kind of like a really important space for all of us coming together and sharing perspectives and like what works, what doesn't work, what really is needed from, let's say, the public health perspective, from the school's perspective, et cetera. I was gonna say, so we meet at Waymakers once a month, but also it's like a working lunch meeting, and it's catered by someone in the community. So Waymakers like contracts like a señora, a lady that has like her own like little business, and they cater our food. And she tries, Natasha, who's the executive director of Waymakers, she tries to find like different countries of origin. So we've had kind of like Salvadoran pupusas, and then another meeting, it's Mexican food. But these are all, we're trying to support the community through this instead of like, let's say, getting pizza or whatever. So this is a steering or part of the steering committee. Oh, here's another picture with more people, and we have a picture of the food. And it's like always really nice. And we met this past Wednesday, and we had like tamales and empanadas, gorditas. Another important part of our grant is co-learning opportunities. So we want everyone to be to get the skills needed and the information needed to advance the work that Alma is doing, but also so that they can use in their jobs, right? In their day-to-day work in the community. So every 3 months we have a presentation. We have an invited guest speaker. And during those meetings, our core group of Alma steering committee is we're about 12 people. But for these co-learning opportunities, all of the partner organizations can invite more of their staff, people who they think could benefit from learning from these topics. So we had, in this picture over here, it's Freddy Mejia from the Commonwealth Institute. He's a policy director, and he came to talk about policy advocacy and how you can advocate for the Latino community or for topics that you're interested in. And then in the picture over here on the bottom is Angelique Ferguson. She's a clinical psychologist with a lot of knowledge about like culturally appropriate services. She's a executive director of an organization called Parenting Culture, and she came to talk about trauma-informed care and also how to kind of like translate this kind of like very broad, let's say academic term to like actual working with Latino youth. So as part of the, so we have this, I talked about the participatory community assessment. So we have the steering committee, we're like the core people. And then we have we created the Parent Advisory Council and the Youth Advisory Council. And they're kind of like informing the work that the steering committee is doing, but also playing a really important role in the development of our focus group questions. They know that we're going to do these focus groups in the summer, so they're going to help us recruit people for the focus groups, but also we're workshopping the focus group questions with them. I did it last week with the youth at our meeting, and I brought the printed out questions. They were based on things we talked about during our first meeting, which I'll show in a bit. And then I was like, here are the questions, read them, what do you think? Like, do they make sense? Are we missing stuff? Are any of the questions hard to understand? And yeah, I mean, they were great. They added a bunch of questions that were great about neighborhoods, about parents, and then they were like, well, this is too sensitive to start with, so move this around. So they played a really, really important role, and some of them even want to like do some of the interviews with us. So they're very, very engaged. With the Parent Advisory Council, we're having our second meeting next week, actually, and I'll do the same with them. With the parents, our goal originally was to have a group of dads, a group of moms. And we thought we would have them separate so that people could feel maybe more comfortable talking about these issues. But it was really hard to recruit dads for this advisory council. So our Parent Advisory Council, we have 18 members, but we have one dad as part of that group and one grandmother, which is also great because many of these families live in multi-generational households. So it's also been really interesting to hear the perspective of the grandmother and like, I don't know how to talk with my granddaughter, like I don't understand her. So it's good having that perspective. So actually this is when we were recruiting. So the advisory councils we recruited with the help of our community partners. And we created this flyer. It's in Spanish because everything we're doing is in Spanish, the advisory council and also the focus groups. So this is just our recruitment flyer for the youth advisory council. Our friends, our community partners in the schools, gave them around in the high schools. Also, a really important source of advisory council members was the community health center, they have a Facebook group, and they shared the flyer. And a lot of the kids were like, yeah, my mom saw it on Facebook, and she told me to come. So just a note, Facebook is a good way to recruit people. As part of the advisory council, people commit to coming to 4 meetings over the 2 years of the project. We might add another one in the summer, and then they get $50. A $50 gift card for their time and for coming to the meeting, and then also we have lunch that's also catered by someone in the community. This is our flyer for the parents. They also get a $50 gift card, and this is something that we were discussing in the ALMA meetings. They were like, the kids have to get exactly the same amount as the parents. I mean, they're contributing just as much, and they should receive the same amount. And of course, like the parents know that the kids are going to get the money. So again, 4 meetings, and we have a project coordinator who has been just instrumental, Lorena Suarez Cabrera, and I think this is kind of like a key thing for those working or wanting to work with the Latino community. Just like the personal connections and the personal follow-up is crucial for getting this community involved. So before each meeting, like she texts them or calls them every 2 weeks just to kind of like check in and remind them like, hey, our meeting is next week. Do you need anything? And she's also kind of like referred them to some services that they need. But just kind of like knowing that it's someone that they can trust, especially now in this climate. I think VCU does kind of like instill some trust, but also just that personal connection has been crucial. So just to illustrate, so this is a map of the racial ethnic makeup of Richmond, the majority. And so most of our efforts are centering like on the south side of Richmond, which is where it's the yellow part, and that's pretty much where we have the predominantly Latino population. Although for the focus groups, I want us to like include people who live in other parts of the city because their experiences might be different. So this is the Southwood Apartments, La Mancha, it's also called informally. That's where a large number of our community, our advisory council members come from. And actually, we hold our advisory council meetings at, they have a pool house, which is more like a community space, because transportation is a very, very big issue for this community. Our community partners have a good relationship with the apartment complex, so they let us use this little pool house for our meetings. And then most people just like, a lot of the people live there, so they just walk to the pool house, and others live close by within driving distance. So this is a picture of the Parent Advisory Council. I think most of them are in this picture. And then just pictures of like us like working and the food that we have. Also important is that we provide childcare, and we were talking about that with the students. Childcare is a big issue. So I have some great students who come, and it's not a big space, the pool house. So we have like a little corner where I bring my kids puzzles and coloring books, and they play with the kids. Mostly they're like 5 and under, so that the moms can come and be part of the meeting, right? And of course, I mean, that removes a barrier, right? Of like, I do want to go, but I don't have anybody to take care of my kids. Don't worry, we can take care of them. But it's also been like a really nice space for community. And after the first meeting, which was in January, I was like, okay, so our next meeting is going to be in April. And they were like, why? Like, can we do it sooner? Like, and it just illustrates this kind of like need for community and this social isolation, which I will talk about in a bit. Unfortunately, we've had 2 meetings with the youth, and I've forgotten to take pictures at both of them. But they're a great bunch of students. So just to wrap up, we've had our first meeting with the advisory council was pretty much a very unstructured conversation with them. Had a list of topics that I wanted to just like hear their thoughts on, and then I let them kind of take the conversation in the direction that they wanted. Mostly we wanted to just hear what their concerns were, not only in terms of their own lives for the parents and the kids, but also like, what do you see in the community with your friends, with your neighbors? Like, what are some issues, some concerns that you think are important for us to know? So with the parents, they talk a lot about mental health concerns, which is pretty much the same as what I showed in a few slides before. Depression, the mood disorders, PTSD, and also a lot of behavioral concerns. Maybe smoking or drugs, maybe power struggles, kind of like parents and kids, skipping school, things like that. But then I asked them, like, well, these are all things that you can see, but what do you think is like what lies at the heart or at the root of these problems? So that's when they kind of like talked about what they would see in the community or in their kids. So one big topic was malas amistades, or like they're hanging out with the wrong crowd. They also talked about like there were a lot of concerns on the parents' side of like what was happening in the school. So bullying, their kids like being afraid because like there were a lot of fights in schools, things like that. And they also talked about migration-related factors. It didn't occur to them immediately until I prompted them. They're like, oh, you know what? Yeah, my daughter has like these nightmares because of the migration journey, or maybe many of them fearing their parents' deportation and so on. So this was really, this kind of confirmed what we already know in the literature, right? But when we heard about from the youth, that was kind of like more eye-opening. And we could see kind of like how parents and kids kind of like see things very differently. So with the kids, the main topic, I want to talk about school because that's what the parents are worried about. But the main topic that they want to talk about was their parents and how much they need their parents, how much they're like hungry for quality time with them. And it's not that the parents don't love them. I mean, we have the parents who are very involved in this group, right? But again, it comes down to like structural issues. Parents work so much. They need to provide to their family. They have 2 or 3 jobs. They rarely see their kids. And that kind of like really has affected these kids. There's also one thing that was really interesting was just a lot of being very concerned for their parents and for like taking care of their parents. When I asked them, like, when they were talking about the mental health problems, I asked them, like, well, do you feel comfortable sharing these, your problems or your feelings with your parents? And some were like, no, they will never understand, like typical like teenage response. But some of them were like, well, I don't want to worry them. Like, I just feel very guilty of like being another cause of concern for them. A couple of them were worried of like, I'm afraid that one of the kids, his mom is sick, and he was like, I think I caused her illness because of my bad behavior. So just like a lot, that it just like weighs a lot on them, like their parents' well-being. And they also talked about lack of communication, how they couldn't even share this with them, right? And then when we talked about like the underlying root causes, they talked a lot about this parent-child relationship. But not only do they not spend time with their parents right now, but they've never spent it when they were little, right? And many would say like, yeah, now my mom or my dad, they tell me like, hey, let's go to the movies or let's go to dinner. And they're like, no, like it's too late. Like they should have like fostered that relationship when I was younger. But of course, like they're not gonna understand like the broader structural conditions, right? They just see that their parent isn't there. Another important thing is that many of them live with extended family, not with their parents, but extended family members. And some might live in unsafe conditions. So that is kind of like a big concern. Or even like they might live with like one parent, but then like distant cousins and uncles, everybody in the same house, and that was like a cause of stress. But the other thing was just, again, social isolation. And transportation, again, coming up as like this big source of social isolation because the parents are working all the time. They can't take their kids anywhere. And then they don't drive. And I mean, cities here, like they're not made to walk. So they're just like at home always. They don't go to like after school activities or like sports or social activities. So there's just like need for community. It was just like so evident, and how they wanted to organize trips to the river, and like, yes, and we can do like a sports, when they were I was talking about solution. We can organize a sports league and among like different schools, like, and they really want to be involved in the solution, which I think was really interesting. So like I said, we'll do the focus groups next during the summer, again with input from the community. But then we don't want it to just end there, right? Like we want to our partnership to result in practical solutions, not just like, oh, here are the problems, isolation is a problem, lack of quality time is a problem, and then just kind of like leave it at that. And that is kind of like where the policy advocacy comes in. As part of our grant, we will write a report with recommendations. But what we're thinking more, when we think about policy, we always think about policy at like the law level, like creating policies, right? But one thing that we've been talking a lot about is also policy change at the organizational level. So what changes can, let's say, the schools implement? What changes could the community implement? Maybe the department, the health department, even VCU. Like, what actual changes can we motivate to happen, rather than just relying on, we will advocate with legislators for more bilingual counselors or whatever. So that's kind of like where we're really talking about how will this then translate into actual change at any level. We don't need like big, a capital P policy change, right? Which then feeds into kind of like our next big question for our project, which is the issue of sustainability. Like my partners have told me, like, we've seen this many times, like, how will this be different? How do we ensure that this is sustainable? What do we want ALMA to be? We don't want it to just be a group that does focus groups, right? So we're talking about, should we get funding to like actually create some of the programs that we see are needed? Or maybe establish more connections between different organizations that we know are doing the work, different types of work, and they could connect. So this is an open-ended question that I cannot answer on my own. This kind of needs the input of all of the community members. But we are committed to just to keep it going, rather than just writing our report and then ending our meetings. So I think this is just my last slide, just thanking everybody who has been involved. Dr. Rose Corona, she's my co-investigator in the psychology department and a leader in like doing these community assessments. Lorena is the project coordinator, the Clark Hill Institute, of course, our community partners, and also my student researchers who have been really helpful in the practical aspects of this work. So yeah, thank you so much, and I would love to hear your questions, and that's my email if anybody wants to contact me.
I think we have time for questions, and just raise your hand. I've got a microphone I'll bring to you just so that we can pick it up on our video.
I'm just gonna move over here.
Hi. So I just wanted to know, I feel like usually the Latino community is not very open about mental health, and especially my experience, I've seen that it's seen as like a American illness, not like a thing that we have. What challenges and how did you get through, especially the parents, to talk and open up about these issues?
Yeah, that's a great question, and it was something that like the Youth Advisory Council would bring up a lot. Like they're fine talking about mental health, and I mean like young people today, right? Like they're fine saying they have depression or anxiety. It's not a taboo topic, but they would say like, oh, but with my parents, like you can't talk about it. Or one thing that they were concerned about was like shame. And like, well, if my daughter has anxiety, it's because I didn't do something well. And they didn't want, again, because they worry about their parents, they didn't want their parents to have, like, feel that guilt of like, oh, it's because of me, right? But actually during our, with the Parent Advisory Council, I mean, they knew that the topic was about mental health, and they are really concerned for their kids, right? So I think there are we've advanced on this topic, but I think there is awareness that like seeing a counselor is fine, and some of the parents kind of like ask for references, like, do you know where I could find some like mental health support for my children? But I think it's more like just the need for education. And like demystifying, but also since it's a topic that isn't maybe talked a lot about in the community, they simply might not be able to recognize that like a behavior is like, it's a mental health problem, right? It's not that they're just like being bad kids or whatever. So I think it's just a lot of education with the parents, and the need for more like open lines of communication with their kids. Yeah, thank you. Yes.
Okay, I don't have like a fully formed question, but I'm just kind of wondering about like the role of our like Richmond public schools in kind of all this, and like facilitating, like you kind of mentioned, like there is or there seems to be kind of a disconnect in terms of like parents and their kids in terms of how to communicate about these different health outcomes and about these concerns, because it seems like there's concerns on both sides. And I'm wondering, like, is the school kind of like, are there like maybe, I don't know, like extra education for parents about this? Is there like, I don't know, like I'm just wondering what kind of like social, like whether it be from the schools or not, like I don't know, what kind of like, is there a third kind of role in terms of social services or family kind of like programming that could facilitate this, or I don't know?
Yeah, that's a great question. So actually, Richmond Public Schools, they have a family welcome center. And some of the members of that welcome center are part of ALMA. And I mean, they do a great job in like establishing those relationships with the families. But there could be, I think one issue that they run into is like, well, we also need to educate like the broader school district, right? Not just the people who like work with these immigrants ourselves and that we are bilingual and bicultural. So like, how do we educate also the teachers? Because there's also always like this frustration, well, the parents don't come to these things. They have an advisory council, parent advisory council at the school district. And I think there's very few Latinos involved, right? So maybe also kind of like understanding like why aren't they involved? Again, it's not that they don't care about their kids, but just like work schedules, transportation, childcare, like these structural issues that we know, but that maybe kind of like aren't taken into consideration when they plan these other events. But no, I mean, Richmond Public Schools also has, they've done some like workshops for parents. Again, sometimes it all comes down to funding and like people being like really stretched thin of like, well, I can't also give a workshop. But I think they've done a really, really good job in like, especially in the welcome center when families first arrive, kind of like explaining like how the school system works in the US and like who do you contact when you have some problems. So I think they've, I mean, again, since a rapid growing population, they've been learning as they go. And actually, I forgot to say that in my slide when I had like the number of kids in 2003, I had a star next to it because I was giving the statistic to someone who works at RPS, and she was like, well, data collection wasn't great 20 years ago. So she's like, I'm not sure about that 600 students. But it just shows that like today, like they're now more aware of like, okay, we need to keep track of these students so that we can offer those services. What other questions do we have?
Yeah, I was curious if you were mentioning a lot about the social isolation that the kids were like showing that they experienced from their parents. Did the parents also express any same sort of sentiment, or did you tell them about that sentiment expressed by their children?
Yeah, that's an interesting question. So I haven't. I don't know if I'll mention it at our meeting with the parents next week. But it's interesting just to see kind of like the different perspectives, because the parents, on the other hand, were like, well, they're hanging out with all the wrong people. Like, they never talked about the isolation, right? Like, maybe they don't recognize it. There was some talks about like, well, some children kind of like are very withdrawn and like in their rooms. They don't want to like see people, but that might be more like a disorder, right? But not really recognizing the isolation that their kids have. That like, well, you know what? They never hang out with anyone, and they don't go out, or they don't do social things. I mean, they did recognize, oh, it would be great to have more sports, things like that. But I don't think the isolation part is like something that they're very, very aware of.
I was wondering if you saw a difference, or if this was even a factor in children that had siblings versus children that didn't, and maybe especially like an older sibling could, maybe they take on the brunt more, but they can be supportive to the younger siblings, and that would be an interesting dynamic to see.
Yes, that's something that we found here with our advisory council members, and just kind of something that is like very common. Like Latino youth in general. One is the issue of parentification, where they're given adult roles at a very young age, right? And like having these responsibilities of like taking care of your siblings and like driving them to school, and yeah, kind of like this pressure of being kind of like the role model that maybe the younger siblings don't have, right? But then there's also another interesting dynamic. It hasn't come up in these conversations, but it's come up with Latino Virginia interviews. Very interesting sibling dynamics when one was born in the country of origin and the other one was born here, because they have kind of like different rights, access to different things, but especially when you have like family separation, reunification. So in some cases, the kid is born like in the country of origin. The parents come to the U.S. They kind of like establish themselves here, have another kid or kids, multiple, and then they bring their child that was left in the country of origin. So then they've been away from their parents, like separated from their parents for many years, and now there's like these two strangers, and that is like often a cause of like conflict or resentment of like, well, I didn't have my parents for 5 years and you've been with them all this time. But yeah, good question. Yes.
Thank you. I was just interested to hear more details about the programming that you talked about, like how to make like a tangible and sustainable action. So like some of the programming that was talked about in the, not the focus groups, the councils already. Like, so yeah, what were people interested in? I'm just curious, and yeah.
Yeah, so when I was talking with the kids about like, well, recruitment strategies and like how can we get like kids to like participate in these focus groups, well, just for them, I call them like discussion groups. They wanted to turn it into a social thing. They wanted to have this like great event, and when someone had this great idea of like sandwiching the focus groups in between programming. So they were like, we can start with like a soccer game, and then everybody goes into the focus groups, and then we end with like another sport event or like art. I'm like, well, this is like a full day thing that you want to do, which is just like another example of like they just want to do stuff, and also they want to be the ones that organize it. But then I asked like, so what kind of activities would you like? Because not everybody likes sports, right? I mean, sport was one thing. They said soccer, volleyball, but then they talked about like art. Someone suggested like that, pass the painting. activity. So it's really just like really simple things that just like create like a space where we all come together and we do something like healthy and it's a safe space. So it doesn't have to be like something really, really big. So, I mean, just some ideas for those of you kind of like involved in the community, that it's just this like need for a space. But again, like the issue is like, where do you do it? And another issue was like time, right? Because a lot of them work. So then many of them were like weekends, 3 to 7, or like a lot of these like Latino teenagers work in restaurants, and they're like Mondays and Wednesdays are the slow days at the restaurants. So then like or Monday or Wednesday after 5. Like they were very specific, but this is good information to have, right? Not just like for us in terms of research, but again for programming purposes of like. Because of course it's a frustration of many organizations of like we do these things but nobody shows up. So again, these are part of the recommendations are just like these very practical things of like how to reach this community.
This is so amazing. I can't believe you do this. Really incredible. Can you tell us a little, I mean, this is probably a self-serving question, but like, how do you go about selecting these community partners? Like, can you talk about that a little bit? Because, I mean, part of it's like trust. Like, how do you know that you can trust them, that they are doing good stuff that you want to be part of and connected to? And like, the second part of the question is, did you think about engaging other like city or county departments in this? Like I think about like Parks and Rec or something like that. I don't know. I just would love to hear a little bit more about the process.
That's a great question. So in this case, like I already had like a relationship established with the city of Richmond, with the Office of Immigrant and Refugee Engagement, because we had been talking about for a while, like how can we collaborate? And then we kind of like came up with this idea, and I was like, okay, so who are the key players that we need to include, right? And of course, like she has been working in the community for a really long time, and she like knows the key players, and she told me kind of like who to contact. But like, of course, Richmond Public Schools was one, and then the health department, which has this clinic. And then we also wanted to include a nonprofit organization, right? So just get a different perspective. But of course, that meant that we're not engaging with like all the potential actors, right? Which was hard in terms of like deciding how big or how small we wanted to have this group. So I think right now, like with these 4 organizations, it's enough. Like. And even though, I mean, we're 12, but like sometimes like the conversation keeps going and going and going, and we just need to like end the meeting. But of course, like there's a lot of people that like thinking about like, let's say programming. There's a new community center in the South Side. So we're like, well, maybe those activities can be done there. So then fortunately, all of these partners have connections. So then like, okay, so you're responsible for contacting these other people. Another organization that we wanted to include was the library. But then, interestingly, when I asked the students like where to do the focus groups, and I was like, just ideas of like a library or like the schools, blah, blah. They were like, library, no. Like it's library equals boring. So then we're like, okay, maybe we need to work with them so that we can make this like a more accessible space for this community, something that is kind of like, and maybe for me, because I'm a mom and I take my kids to story time, I think that the library is great. But I think maybe this is kind of like another safe space that is free. There's a lot of libraries like in the communities that they could be part of the conversation. But I think right now we all agree that like, for now, we're like the right size, but of course, but we will kind of collaborate depending on like the different areas. But also, yeah, the trust part, and also for me, not just coming as like this like lonely researcher reaching out to people saying like, oh, like so and so like told me to reach out to you. We're doing this project that also kind of like gives more like legitimacy to me and to the project, saying like these other players are interested. And you should also be part of this project.
Hi, I was just curious about if you have or plan to like include any like clinical interventions or like have you thought about including like mental health professionals in this work or like any sort of counseling or like therapy approaches to this like beyond the community level?
Yeah, that's a great question because we don't have. I mean, other than Rose, my colleague who's a psychology professor, we actually don't have any like mental health specific individuals. But something that we have like been. It just came up in our meeting last Wednesday. Like that, we don't want to duplicate what other people are doing, right? It's just sometimes that often happens. And actually, even at VCU, there's a lot of people doing clinical work in the community. So I think it's kind of like we just need to kind of create awareness of what services exist, and instead of duplicating, maybe just referring people to the services. Like I just found out there's a social work professor who has like a clinical psych project for like in La Mancha, like the actual apartments. I'm like, had I known, I would have sent you people. But I think that's where like being in touch with other members in the community and streamlining a lot of these efforts, because I think that's kind of like one of the weaknesses that like all of these different projects emerge with different grants, and then some disappear, or others just like duplicate because the grant is asking for them. So we want to maybe be more of a organization that refers to like other projects or programs that already exist. Thank you. All right, so we can leave it at that. I'll stay here for a while if anybody wants to talk. Thank you so much.
Please join me.